What if the shortness of breath you felt climbing the stairs this morning wasn't just age catching up with you, but your heart quietly crying for help? Every single year, over 6 million Americans live with heart failure. And the most tragic truth is this: most don't realize it until their condition has already become life-threatening. That means ordinary men and women, people just like you, wake up each day ignoring the very warning signs that could save their lives. I'm Dr. Edward Blake, and today I need you to pay close attention because your body may already be whispering clues that you've been dismissing as stress fatigue or simply getting older. These signals aren't random and they aren't harmless. They're your heart sending out an SOS before it's too late. But here's the hopeful part: if you learn how to recognize these early signs, you can take control of your health, protect your future, and quite literally extend your life. Over the next few minutes, I'm going to reveal 13 warning signs of heart failure that most people completely overlook, and I promise you this: by the end, you'll know exactly what to watch for and when to seek help. So let's begin with the very first sign, one that often hides in plain sight and feels so ordinary that people brush it off until it's far too late: shortness of breath during everyday activity. The first red flag is one so common that millions of people wave it off every single day: shortness of breath during ordinary activity. I'm not talking about gasping after a marathon or pushing yourself at the gym. I mean the simple, everyday things: walking to the mailbox, climbing a single flight of stairs, or even carrying a grocery bag, and suddenly realizing you need to stop, catch your breath, and recover like you just ran a race. Let me tell you a quick story. A patient of mine, Mark, 58 years old, thought he was just out of shape. He noticed that walking from the parking lot to his office left him winded. He laughed it off, blamed the extra pounds, and kept going. But here's the truth: what he was experiencing wasn't about fitness. It was his heart quietly failing to pump enough oxygen-rich blood to his muscles. Within months, he was admitted to the hospital with heart failure that could have been caught earlier if only he had paid attention to this subtle but powerful clue. And the science is undeniable. Research from the American Heart Association confirms that this symptom, called exertional dyspnea, is one of the earliest and most overlooked warning signs of heart failure. It happens because your heart is no longer pumping strongly enough to meet your body's needs, so your lungs step in working overtime to make up for the deficit. That's why the breathlessness feels out of proportion to the effort. It's your body compensating for a heart under strain. So if daily tasks that once felt effortless now leave you breathless, it's not just age. It's not laziness. It's your heart sending an urgent message, and ignoring it could cost you everything. But only recognizing this symptom isn't enough, because there's another hidden signal that sneaks in while you sleep, and it's even more dangerous than breathlessness in the daytime. And here's where things get even scarier. You see, breathlessness doesn't just show up when you're moving through the day. It can follow you into the night. If you've noticed that lying flat in bed makes it harder to breathe, forcing you to prop yourself up with extra pillows, that's a textbook warning sign called orthopnea. At first, it seems harmless. You add one pillow, then two, then before long, you find yourself sleeping half upright in a recliner because it's the only way you can breathe comfortably. Most people shrug this off as a matter of sleeping preference or a bad mattress. But what's really happening inside is far more serious. When you lie down, gravity is no longer helping your heart move blood up from your legs. If your heart is weak, blood begins to pool and back up into your lungs. Fluid seeps into those tiny air spaces, and suddenly breathing feels like you're drowning in your own bed. I once treated a woman named Karen who thought her growing pillow stack was just part of getting older. By the time she admitted she was sleeping upright to catch her breath, her heart failure had advanced far beyond the early stages. The tragedy: if she had recognized that signal sooner, her journey could have been so different, and the data speaks volumes. Studies from leading cardiology centers show that orthopnea is present in nearly 80% of patients with heart failure, 8 out of 10. That means if you or someone you love is piling up pillows just to breathe through the night, the odds are high that the heart is already crying for help. But here's the twist: while this symptom creeps in slowly, the next one can hit you like a storm in the middle of the night, jolting you awake in sheer panic. And when it happens, people often mistake it for a nightmare, when in fact it's one of the most terrifying signs of all. Imagine this: you're fast asleep, and suddenly you bolt upright in the dark, gasping for air, your heart racing like it's trying to leap out of your chest. It feels like you're suffocating, like someone is pressing a heavy weight against your lungs. That terrifying experience has a name, paroxysmal nocturnal dyspnea, and it's one of the most dramatic warning signs of heart failure. I remember a patient, Daniel, who swore he was having nightmares. He'd wake up drenched in sweat, gasping at an open window, desperate for fresh air. But it wasn't bad dreams haunting him. It was his heart failing to handle the sudden rush of fluid, shifting from his legs back to his lungs while he slept. His weakened heart simply couldn't keep up, and his body's only response was to wake him up in panic mode, fighting for each breath. The science behind it is chilling. Clinical studies show these episodes usually strike 2 to 4 hours after you fall asleep, just when your body should be in its deepest rest. Instead, your lungs fill with fluid, your oxygen plummets, and your nervous system slams you awake. Many people brush it off as stress, anxiety, or even sleep apnea. But here's the crucial difference. If you're jolted awake, gasping for air, that only gets better when you sit or stand up, that's not a dream. It's your heart sending a desperate SOS. And the danger doesn't end there, because while these nighttime attacks feel terrifying in the moment, the silent fatigue they create during the day may be even more deadly. Which brings us straight to the next red flag, the kind of exhaustion that sleep can't fix, slowly draining your strength and stealing away your daily life. If gasping for air at night is the most frightening signal, then unrelenting exhaustion is the most underestimated. I'm not talking about the kind of tiredness you feel after a busy day that disappears with a good night's sleep. I mean a deep, bone-heavy fatigue that lingers no matter how much you rest to drain, that turns simple daily tasks into uphill battles. Take Michael, a 62-year-old teacher who loved gardening. Over a few months, he noticed that pulling weeds or carrying a watering can left him completely wiped out. He'd tell his wife, "I just need more sleep." But the truth was darker. His heart was no longer pumping enough oxygen-rich blood to his muscles. To survive, his body began rerouting blood away from less essential areas, leaving his arms and legs starved for energy. The result, a creeping weakness that made his world smaller and smaller. Medical research shows this kind of fatigue is one of the earliest and easiest to dismiss signs of heart failure. What makes it especially dangerous is how gradually it steals your life. First, you avoid long walks, then you skip social events. Before you know it, even showering or climbing a few steps feels overwhelming. And while you may blame aging, the reality is that your heart is struggling with even the basics of circulation. So if you've noticed that your recovery time after activity is stretching longer and longer, or that tasks you once enjoyed now feel impossible, don't ignore it. Fatigue is more than just tiredness. It's your body running on emergency mode. But the heart doesn't just whisper through fatigue. Sometimes it shows its struggle in a way you can actually see with your own eyes. And that visible clue often appears first in your ankles and legs. Sometimes the heart doesn't just whisper, it leaves visible footprints. One of the most telling is swelling in your ankles, feet, or legs, a condition doctors call peripheral edema. At first, it may look like puffiness you'd get after a long day on your feet. But when it happens regularly, and especially when it worsens by evening, it's a sign your heart is falling behind on its job. I'll never forget a patient named Linda who came into my office wearing slip-on shoes because her favorite pair no longer fit. She thought it was just getting older or eating too much salt. But when I pressed gently on her ankle, a deep indentation remained in her skin for several seconds. That's not normal swelling. It's her heart unable to circulate blood properly, causing fluid to pool in her lower body. The science is striking. Studies show about 70% of people diagnosed with heart failure already had this kind of swelling when they were first evaluated. It starts at the ankles and feet, then can creep upward to the calves and even thighs. Along the way, rings may feel tighter, shoes too snug, and socks leave marks etched in the skin. It's the body's way of saying circulation is failing, and your kidneys, overwhelmed by poor blood flow, are holding on to salt and water they can't release. So if you notice your legs growing heavier or swelling that doesn't go away with a night's rest, don't dismiss it as aging or too much sitting. That fluid is more than an inconvenience, it's a warning. And here's the kicker: while swelling is something you can see, the next red flag is one you can measure on the scale, and the speed at which it shows up can be shocking. If swelling in your legs is the warning you can see, then rapid weight gain is the alarm you can track. And it's not about eating too much or indulging in dessert. It's about fluid silently building inside your body. Imagine stepping on the scale and realizing you've gained 2 or 3 pounds overnight or 5 pounds in less than a week, even though your diet hasn't changed. That kind of weight spike is one of the clearest signs your heart is struggling. One of my patients, George, a retired mechanic, thought his bathroom scale was broken. In just 4 days, he'd gained 6 pounds without changing a single thing about his meals. But what was happening inside his body was no mystery. His weakened heart had triggered a chain reaction, causing his kidneys to hold on to salt and water instead of flushing it out. Every extra pound was another pint of fluid, filling his tissues and making it harder to breathe. The American Heart Association warns that sudden weight gain like this is not only an early marker of heart failure, but one of the most reliable indicators of worsening disease. That's why many doctors advise patients to weigh themselves daily, because the scale doesn't lie. Unlike gradual changes in body fat, fluid retention creates a steady upward curve that demands attention. So if you've ever noticed that your rings feel tighter, your clothes fit differently, or your belly feels bloated while the number on the scale keeps climbing, take it seriously. It may not be food, it may be fluid. And while a scale can show you what's happening, the next red flag often shows itself at night in a place most people never connect to their heart, the bathroom. If the scale reveals fluid during the day, the bathroom often tells the story at night. Many people brush off waking up 2, 3, even 4 times to urinate as just getting older or drinking too much water before bed. But in reality, this sudden shift is often a subtle but powerful sign of heart failure, and it happens for a very specific reason. Here's what's going on inside your body during the day. Gravity pulls fluid into your legs and ankles where it quietly collects. But the moment you lie down at night, that fluid redistributes back into your bloodstream. Your kidneys, suddenly flooded, go into overdrive, forcing you to wake again and again to empty your bladder. I once met a man named Robert who joked that his dog saw him more at night than during the day because he was up every hour walking back and forth to the bathroom. What he didn't realize was that each trip wasn't about his bladder, it was about his heart struggling to manage the extra fluid that his circulation could no longer handle. Research published in cardiology journals shows nocturia can appear early sometimes before obvious symptoms like swelling or breathlessness. And unlike ordinary bathroom habits, the volumes are usually larger than normal because it's not hydration driving the urge, it's your kidneys desperately trying to clear out what your failing heart couldn't move during the day. So if nighttime has become a cycle of waking and walking to the bathroom, don't just blame age. Your body might be revealing that your heart is in trouble, and yet the clues don't stop there. Because while nocturia pulls you out of sleep, another symptom can keep you awake entirely. A dry, nagging cough that shows up when you lie down, whispering another warning from deep inside your lungs. If frequent trips to the bathroom keep pulling you out of sleep, there's another symptom that can stop you from falling asleep at all, a nagging cough that seems to come alive the moment you lie down. This isn't the tickle of allergies or the chest rattle of a cold. It's a dry, persistent cough sometimes with a faint wheeze that mysteriously eases when you sit up. I'll never forget Margaret, a 65-year-old grandmother, who told me she had developed what she called her bedtime cough. Every night, just as she settled under the covers, it would start an irritating hack that kept her awake and restless. She blamed dust, then her pillow, then even her old furnace. But the real culprit wasn't in her home, it was in her heart. When she lay flat, fluid shifted toward her lungs, irritating her airways and sparking that stubborn cough. Medical literature confirms this pattern. The cough is often worse in the early hours of the morning, sometimes bringing up frothy pink-tinged mucus, a chilling sign that fluid is leaking into the lungs. It's one of the most deceptive red flags because patients often blame it on postnasal drip or acid reflux, never realizing their heart is waving a red flag in disguise. So if you notice a cough that consistently shows up when you lie down, don't dismiss it as seasonal allergies or poor air quality. It may be your body's way of warning that your lungs are bearing the burden of a weakened heart. And if your nights are already haunted by breathlessness and coughing, imagine what happens when your days are suddenly disrupted by your heart itself skipping, beats racing and pounding when you least expect it. If a nighttime cough makes you restless, the next sign can shake you to your core. Feeling your own heart stumble, Palpitations often feel like your heart is fluttering, pounding, skipping beats, or even doing somersaults in your chest. Some describe it as a sudden thump, others as a rapid race that strikes without warning, even while they're sitting quietly. One of my patients, Evelyn, was folding laundry when it hit her. Out of nowhere, her heart began racing so wildly she had to sit down. She thought it was just anxiety, but when the episodes became more frequent, always worse when she was lying in bed, it turned out her heart rhythm was spiraling into chaos. What she felt as flutters and skips was her weakened heart trying desperately to pump blood against mounting pressure. The science behind this is sobering. Research shows irregular rhythms, especially atrial fibrillation, are both a cause and a consequence of heart failure. In other words, your heart's weakness can trigger dangerous arrhythmias, and those arrhythmias in turn can push the heart further into failure, a vicious cycle that worsens with time if left unchecked. So if you ever feel your chest fluttering, pounding, or skipping in a way that doesn't match your activity, don't write it off as nerves. Your body may be alerting you to a deeper silent struggle. And here's the hidden danger: while palpitations might make your heart race, the next sign threatens to cut blood flow to your brain, leaving you dizzy, disoriented, or even collapsing without warning. If palpitations make you uneasy, dizziness can make you feel powerless. We've all stood up too quickly and felt lightheaded for a moment. But what if that sensation keeps happening, even during simple daily activities? For many, this isn't clumsiness or dehydration. It's the brain being starved of blood because the heart can't keep up. I remember Thomas, a 67-year-old carpenter who nearly collapsed while fixing a shelf in his garage. He laughed it off as getting up too fast, but in reality, his weakened heart couldn't pump enough blood upward when he bent and stood again. Every dizzy spell was his brain crying out for oxygen, a silent reminder that his circulation was failing. The research is clear. Studies show that syncope episodes of fainting or near fainting occurs in about 20% of patients with heart failure. It often strikes when standing suddenly, exerting lightly, or even after standing still too long. The failing heart struggles to adjust blood pressure quickly, and the brain pays the price. That's why people often describe the room spinning, their vision dimming, or their legs giving way without warning. And while dizziness may seem harmless if it passes quickly, it can lead to dangerous falls, injuries, and most importantly, it signals a drop in cardiac output that should never be ignored. But here's the twist: while this symptom strikes your head, the next one targets your stomach, stealing your appetite, bloating your belly, and making meals feel impossible. If dizziness makes your head spin, the next sign can rob you of one of life's simplest pleasures: eating. Many people don't realize that heart failure doesn't just affect your chest, it can show up in your stomach too. Persistent bloating, feeling full after just a few bites, or even nausea are early digestive red flags that your circulation is under strain. I'll never forget Carla, a 70-year-old grandmother who came to me saying she had lost her taste for food. She thought it was just aging or stress, but her story was more complex. Her weakened heart wasn't moving blood efficiently, which meant her stomach and liver weren't getting the circulation they needed. Fluid had begun building up in her abdomen, pressing against her organs, making every meal feel heavy and uncomfortable. What she saw as poor appetite was in reality her body signaling cardiac congestion. Science backs this up. Research shows gastrointestinal symptoms are often overlooked, yet they're common in heart failure. Reduced blood flow to the gut, fluid pressing on the liver, and congestion in the abdomen all combine to create nausea, fullness, and loss of appetite. And here's the hidden danger: people often brush it off as indigestion or dietary issues, delaying medical care until the condition worsens. So if food suddenly feels unappealing, if your belly feels tight without overeating, or if you can't enjoy a meal the way you used to listen closely, your heart may be behind it. And while bloating speaks through your stomach, the next sign reveals itself when you bend forward, showing up in a way so specific that once you know it, you'll never forget it. If bloating steals your appetite, the next sign can catch you off guard in the most ordinary of moments: tying your shoes, leaning over a sink, or picking something up off the floor. It's called bendopnea, and it's so specific that most people have never heard of it. Yet for those with heart failure, it can be one of the clearest signals that something is deeply wrong. I once treated Henry, a 64-year-old who thought he was just getting stiff. He noticed that every time he bent forward within seconds, he felt winded, like someone had squeezed the air out of his chest. He didn't realize that bending increases pressure in the abdomen and chest. For a healthy heart, it's barely noticeable, but for a weakened heart already overloaded with pressure, that small shift is enough to trigger instant breathlessness. Medical studies published in major cardiology journals highlight bendopnea as a remarkably reliable marker of advanced heart disease. Roughly one-third of patients with heart failure experience it, and its presence is strongly linked to higher risk and poorer outcomes. That's why it's not just an odd quirk, it's a bright red warning light that your heart is working on the edge of its capacity. So if you find yourself breathless while leaning forward, don't dismiss it as stiffness, posture, or age. Healthy people don't feel that way. It's your heart struggling with pressure it can no longer control. And if breathlessness shows up even in such simple motions, imagine what happens when circulation to your hands and feet begins to fade, leaving them cold, bluish, and starved of warmth. If bendopnea takes your breath when you bend, this final warning sign takes something even more basic: your warmth. Cold hands and feet, even in a warm room, are more than just poor circulation from sitting too long. They can be a chilling clue that your heart is no longer pumping forcefully enough to deliver blood to your extremities. Take James, a 71-year-old veteran, who told me he couldn't shake the feeling that his hands were always icy. His wife noticed his fingertips sometimes had a bluish tint, even when the house was cozy. What he thought was bad circulation was really his body in survival mode. When the heart weakens, it prioritizes blood flow to vital organs like the brain and heart itself, leaving the hands and feet starved of warmth and oxygen. The science underscores this. Normally, there should be at least a 40-point difference between your systolic and diastolic blood pressure, the so-called pulse pressure. But in heart failure, that gap narrows significantly, showing that your heart's stroke volume, the blood pushed out with each beat, has fallen dangerously low. That's why cold extremities and narrow pulse pressure often go hand in hand as a silent but urgent red flag. So if your hands and feet are constantly cold, slow to warm up, or tinged with blue despite a warm environment, don't dismiss it. It's not just aging, it may be your heart's final plea for help. And with this 13th sign, the story comes full circle. Your heart is always sending signals, but the question is, are you listening? Because recognizing them early could mean the difference between years of struggle and years of life. If you recognize yourself in even one of these warning signs, don't panic. Take it as your opportunity to act early. Heart failure, when caught in time, can be managed, controlled, and in many cases slowed dramatically. The most powerful step you can take right now is awareness, because every signal your body gives you is a chance to protect your future. That's why I encourage you, save this video so you can come back and review these signs whenever you need to, and share it with someone you care about. It may be the reminder that saves their life. And don't forget to subscribe to this channel for the latest doctor-backed knowledge on heart health and proven strategies to keep your circulation and your body strong. Remember, your heart is more resilient than you think. With the right care, consistent habits, and a little knowledge, you can live not just longer, but better. Hope is always on your side, and your best years may still be ahead.